So I don't understand the Medicaid. The town usually would give us $450,000 in Medicaid money.
Well, it varies,
this year they've decided they're not going to do it.
It varies from year to year.
Okay.
A year ago, we used to, historically Franklin has, tried to guess how much Medicaid reimbursement they will get in the upcoming year. So if we were doing business as usual, I would be here trying to predict how much we're going to get back from the feds next year. So for this year, last year's budget planning for this, we anticipated $313,000 in revenue coming in, and Linda Waters, in her PPS budget, actually, in anticipation of those funds, the way Brad Sidwell anticipates athletic user fees, Linda spent that $313 in funds, programs, people, whatever. We ran into our budget mess. We overspent last year's budget. The town bailed us out, $590,000.
Oh, so this is payback.
What the town administrator recommended is rather than us asking, as we normally do, to get the Medicaid reimbursement, he suggested we didn't ask in recognition of the fact that the town has made up for the budget overspend. And actually, we anticipated $313,000 in Medicaid reimbursement. The town has received $475,000.
Wow.
So one of the
Sounds vaguely familiar from when Jim Valley was here.
One of the things that one of his challenges this year has been, okay, given that we're not getting the 313 we anticipated and actually have planned into the budget, Paul's had to meet the challenge of reducing costs and finding funds to cover that 313 because we don't anticipate getting that reimbursement fund. So the silver lining in all that is that the $590 that the town actually paid to cover the shortfall is really $590 minus $475 that they never anticipated having. So the shortfall, the coverage that they made for us is more like $110,000 or so. So, I mean, I feel good about that we're sort of giving back a great deal of that money, but the hard part is that we have been playing this prediction game, and it's not good budgeting. The auditor suggested that we don't do that as well. We don't anticipate it. What the town administrator, I think, is going to recommend to the full town council is rather than anticipate it and plan on it for operational budget, let's just wait and see what comes in every year, and we'll give it to the schools as capital expense money, which is something we don't always anticipate. So it's not, I mean, hopefully it's not that it's just going to evaporate and we'll never see it again, but it's that we won't plan on it for our operational budget, but we may get it for our capital expenses.
Could I just throw in how we get the money? Because it isn't just a grant or a chunk of money that is arbitrarily donated to the school by the federal government. 4 times a year, the staff, administrators, teachers, special ed teachers, psychologists, nurses, we do a time study. And the amount of funding is based on the services provided by our staff to students. So that's what drives the funds back to us. It's based directly on the level of service that our professional staff provides to students, and we go through a number of calculations. It's transportation for special education students, tuition costs are all factored into that. But it really is, you know, directly linked to the services we provide to students. So, you know, it's labor intensive to get that. It isn't like somebody just says, here's a check. We have to continue that work, that data collection 4 times a year, and then however their formula is, it comes back to the town.
Can I just
I would reiterate that the federal government, I mean, while we are hoping that going forward we'll get it for capital funds, the Bush administration is trying to blow it up because it is extraordinary. I mean, you can just imagine multiply our 475 times every city and town in Massachusetts by 50 different states, it is a huge expense. So do I believe it's going to evaporate? Probably is over time. Whether it will happen this year, I don't know.
I just want to interject one point here so that this point is driven home and that folks in the community understand when they hear or they read about 590 or 580,000 being provided to the schools to, quote, bail them out. That's not accurate, because the 475,000, which is for school services, which we have gotten for at least every year that I've been here, that's 7 or 8 years. That's right. That's gone to the school budget. That was cut off this year, and so it's not appropriate to categorize it as a $580,000 bailout. It's more like $110,000. Is that fair to say?
Yeah. I mean, it was a $580,000 bailout at the moment, and then we were fortunate enough to get 475.
But we knew that money was coming.
Well, we knew 313 was coming, and we just got that extra money. But yes, if you,
We did a lot of
you
paperwork.
do the subtraction, and it is ultimately, in terms of what the town had and what the town expended, the net in what was expended, it really is more like 110.
Just one thing that I want to make clear to the community too, is just because we didn't get that money, the services that the students were going to receive for that money are still being received. We didn't take that away from the students. I got to find that someplace else. But Linda is still supplying those students with the needs that we had earmarked that money for.
And then just my final question, if I read the figures in the presentation correctly, if you've taken out of the calculation $400,000 from Medicaid, which is typically what we get in revenue, is it fair to say that the total new revenue that the school department will see is, in actuality, will be $400,000, not $800,000?
Yes, closer to 4 than 80. Again, I have to say that Medicaid reimbursement is always a moving target based on the services you provide this year. You don't get the money until next year, but it's approximately 400.
Okay. That's all I have.